You have the recipes in the email, and the presentation. So,
Oh,
yeah. Mhm.
thank you.
Sure.
Never mind.
Welcome everyone. We're now
Thank
live
you.
on Facebook. This is our special new series, Nutrition During Cancer Treatment. So Elena, I will turn it over to you.
Hi, everybody. Thanks for joining. So today we're going to get into kind of how to work with the side effects that people might be experiencing in treatment. And we're going to do some recipes. So if you've watched any of my other classes, we typically like make a couple of recipes and do the slides. So I'm actually going to get started with a muffin recipe. I have my oven preheating to 350 and we're making peach pecan muffins. I feel like it's seasonally appropriate to be doing that. Um, Now, I like muffins because they are just easy to eat. They're easy to store. So if you're not going to eat all of these in time, they freeze nicely. Um, I Back when I was an undergrad at Penn State, I worked in a food lab where we gave everybody like controlled meals for like a couple weeks. And then, they were studying like walnut oil or flaxseed oil, different things like that. So that would be mixed in. But anytime that their weight started shifting, like if they were losing weight, we would give them, a certain amount of muffins. So we made like a ton of muffins, and those were just used to kind of supplement for people just because they are easy to get down. Um, that texture is usually nice and soft, and they can kind of fit in between. So I thought it would be nice to do a muffin recipe today. So I'm going to start with making a chia seed egg. I don't know if anybody's done that before, but you can do this with chia seeds or flax seeds. So I'm going to do 2 tablespoons of chia seeds. And since I don't have ground chia seeds, I'm actually going to blend these real quick. Blender. My little muffin liners blew away. Um, so that's just gonna help it just not have like a chia seed texture in the muffins. And what we're gonna do is mix. So for every tablespoon, we do 3 tablespoons of water to make either a chia or a flaxseed egg. So I'm gonna do water with this. So we're gonna do 6 tablespoons or a third of a cup of water. Okay, and then I'm just going to just do a quick pour whisking of this, and we're going to let it sit for 5 minutes. And now what that's going to do is it's going to act as a binder, just like eggs do, right? So we can use it for baking. We can use it for like a meatloaf or meatballs, things like that. Definitely like can be cheaper depending on what the egg prices are at to use, something like that instead of eggs, and save the eggs for, your omelets and things like that. Um, so we're going to let that sit. And while that's sitting, we're going to do our oats. So we're going to blend up 2 cups of oats. So just the rolled oats, old-fashioned rolled oats that we're using. And I like to have these on hand blended because I like to throw them also into smoothies. So I'll usually throw like a tablespoon or two into my smoothie. And the great thing about these oats, obviously they're already cooked. Um, so, you can add them to a smoothie. We can make overnight oats with them. There's a ton of things we can do with the old-fashioned rolled oats. I'll just mute this so you don't have to hear my blender right now. Now you can also buy oat flour, but it's more expensive. This is just easier and cheaper to do it this way. Maybe not easier, but certainly cheaper. All right. Now we're going to start prepping our peaches while we're waiting for that to set up. So we're going to do about a cup, about 2.5 peaches for this recipe. Now this recipe, you can swap out really any type of fruit. So, if you don't like peaches, you can use blueberries, strawberries, banana, really whatever fruit you like.
Do you recommend fresh fruit or can you use canned or frozen?
Yeah, you can use canned or frozen. I can't say that I've used canned. If you use canned, I might pull back on like the canned pumpkin, like just use a little less of that. But I've definitely used like frozen blueberries. That has worked well in this recipe. I've also made them chocolate before. So what I like about it is that our base is oats, so it's just like a full oat muffin. So they are a little bit more dense, but sorry, I'm just gonna look at my peaches. It's a little more dense, but like if people need to be gluten-free, obviously it's great for them. Um, and then it also is good for soluble fiber. So we'll talk about how that helps with like loose stool and helping to kind of bind that up. And these peaches were a little larger, so I think I'm just going to stick with the 2 peaches for this recipe. So now we see our chia seeds really have globbed, like turned into a gelatinous. The chia seeds have a ton of this soluble fiber, so they soak up that water that we added to it. Now we're going to add in a 1/3 cup of milk, and you can use any type of milk, plant milk, cow's milk, whatever you have on hand. And then I'm going to do a teaspoon of white vinegar. And that helps. So you'll see that often added to like vegan recipes, the white vinegar. What it does is helps with like the rising of the, the muffin. It doesn't do a ton of rising, but it does give it a little bit of help. Now I'm just gonna mix that again, and we're just gonna let that sit for another 5 minutes. But this can also be something that you can do, oftentimes, friends, family are asking how they can help, right? And people like to have concrete things to do. So if you have some recipes that you want to try, passing a recipe off to somebody who wants to help, can not only help you, but also help them in feeling like they're, doing something constructive for you. So I always think that that's nice to kind of, and this is like an easy thing and, pretty inexpensive for somebody to kind of help you out with making some type of a muffin. Great. And then we're going to chop up our pecans. So we're going to do a 1/2 cup of pecans and we'll chop them up. These really cook up nicely, like they're nice and soft. I mean, they're a soft nut to start with, but then once they're in this recipe, they're even a little bit softer, which is nice. But if you can't tolerate nuts, you can certainly leave them out. You could also take the skin off the peaches, like if you're having to limit some of that, what we call insoluble fiber or that roughage. So if people are having a lot of loose stool, um, even doing a canned peach or something would be, something that might work a little better. Okay. So now we can start adding the other ingredients to this mix. So it's like a nice little bit of a gel, which will just help stick everything together. So now we're going to add, unfortunately, Aldi did not have pumpkin today, and I didn't really want to go to a different store. So I'm using applesauce. So applesauce is interchangeable for the pumpkin. You could also use mashed bananas, although I do feel that you tend to have a little bit more of like a flavor with that. So if you're not looking for a banana flavor, pumpkin or applesauce would work well. And then we're going to add 2 tablespoons of brown sugar. I actually forgot to grab that. Now, if take note that this recipe really it's pretty low in added sugar. So compared to a lot of muffin recipes that you might come across, you're going to only have about 2 grams of added sugar per muffin. So it's very low. Oftentimes if you're making a muffin recipe, it's calling for at least a cup of sugar or maybe even a cup and a half of sugar. So this is a really nice low sugar recipe. I'm going to do 2 tablespoons of the brown sugar. And honestly, you could probably get away with not putting any of this in at all. Because the peaches are pretty sweet by themselves. Great, and then we're gonna do a half teaspoon of baking soda. And then we're gonna do 1 teaspoon of baking powder. We're gonna give that another stir. Then we're gonna fold in our oat flour. Actually, let me measure that real quick. Yeah, we're pretty good. And then we're gonna do this is going to be nice and balanced. We're not going to feel, if we wake up and we have maybe like a Dunkin' Donuts muffin first thing in the morning, our blood sugars kind of have that like spike crash thing happening. That's not going to happen with this just because it's got the fiber, it's low in added sugar. So this should give us a nice balanced feel. I'm going to fold in the peaches and then the pecans. Okay, I'm just going to spoon this into my muffin cups now. We're going to put a decent amount in each. These really don't rise just because they're just dense with the oat flour. So don't be afraid to fill them all the way to the top because they're not going to go much higher than that. And this honestly makes a good bit of batter.
Elena, if I wanted to increase the protein in this recipe a bit, is there anything that you'd recommend adding?
Yeah, you could add some protein powder. So you could I would probably swap out like a half cup of the oats and replace it with a half cup of protein powder.
Okay,
Yep,
thank you.
sure. And you can actually get like the Bob's Red Mill has, I mean, there's other brands too, but they have an unflavored whey, which that would probably be what I would
Okay, thank you.
lean towards. There's also like they also have an almond flour and I mean an almond protein powder if you're looking for plant-based. Okay. And then next week we're going to hone in a little bit more on protein too. And we have I'm working on a recipe that's going to have some protein powder added to it. So I'm going to pop these in for about 22 minutes. We'll just check on them then. The great thing about this recipe is that it's not, there's nothing in it that's like would cause a foodborne illness. So there's no flour, there's no eggs. So obviously we want it to be cooked all the way through just for like texture purposes, but it wouldn't be carrying any bacteria if it weren't. So let me just pop it into the oven. Great. Now we're just going to hop onto our other recipe, which is our ginger syrup. So what we're going to do to start with is get our water and our ginger root to start simmering together in this pot. So we're going to do a cup of water. And then we're going to do a cup of ginger root. So we've got now you can keep the skin on. This I don't love this one. It's like you get like a local organic one, keeping the skin on, or just in general. But this one's from China. I'm just gonna take off the skin just to be on the safe side. Sometimes from other countries, we don't always know what's used in terms of what they're spraying things with. So I'm going to cut it into thin slices because it is, we're going to increase the surface area. So we're going to get more of that flavor and that good, the good oils that kind of have the benefits in them to infuse out. It smells so good. I love ginger. Great. Just do a little tiny bit more. Great. I'm gonna just add this. We're just gonna let that simmer. That's gonna simmer while we're doing our slides. So we're gonna let's bring it to a boil first and then we'll turn it down to simmer. Okay. So I'm gonna share my screen. Right. So obviously, we're all aware that good nutrition is important during treatment. It can obviously help managing side effects, helping maintain weight, feeling better, improving energy, maintaining strength. Um, Now we know that different nutrition related side effects can happen from various pieces of cancer treatment. So tumor location can obviously affect some things just by itself without treatment. Different difficulties with chewing and swallowing, depending on where they're at. You know, Digestion, glucose, all of those things. We know that that can cause some issues. And then also, obviously, like chemotherapy would cause some other issues. So, taste changes, smell changes, nausea, vomiting, diarrhea, mucositis, loss of appetite. And then, treatment related side effects from radiation. So, if people are getting radiation to the head and neck area, obviously, difficulty there with eating. Same thing for the esophagus or like lung tumors that are close to the esophagus, diarrhea, nausea, and then fatigue is pretty much something that hits everybody regardless. And then also, from radiation, regardless of the site, people tend to have fatigue as a side effect. So let's talk about nausea and vomiting first, because that is a relatively common one that people have to deal with. And thankfully, in this day and age, we do have better medications for that. So really the biggest recommendation is to follow that schedule that's provided by your doctor. If it's not working, having that conversation either with them at your checkup or the infusion nurses. You're going to obviously see the infusion nurses more often. So, bringing it up to them can be really helpful because they'll have different tips and tricks, or they can adjust what you're getting, going through with all of that. Another piece of that is making sure that the bowels are moving well. Sometimes when people are very constipated, that can even cause some nausea. Small frequent meals tend to help a little bit more than a large meal. Having something at the like the nightstand for when you wake up. So maybe it's a couple crackers, just something to get into your stomach before you stand up and start moving around. Sometimes having liquids in between meals can help. So sometimes drinking a bunch with our meal, is going to make it a little bit, uncomfortable, but separating it out a little bit can help. And then timing meals for when we know the medications are going to work best. The other thing would be, if you are allowed to take food, take your medications with food, take them with food, because certain ones will hit you in different ways. Even something as simple as iron or like a multivitamin that has iron in it can increase nausea on an empty stomach. And then there's ginger. So there is research on ginger improving nausea. So in all sorts of different forms. So today we're going to make this ginger syrup. You might also try ginger tea. So just steeping, like whatever is going to come out of me steeping this ginger root in water would be a ginger tea, right? We could also do, some people just even like chew on like ginger, although that can be a little bit strong. Ginger ale, ginger beer. So ginger beer tends now to be made a little bit, I think it's like ginger ale is not really made from real ginger anymore, but the nicer brands of like ginger beer, which aren't really beer, but almost like a root beer, they are made from real ginger. And then peppermint oil is an interesting one. So adding a couple drops of peppermint oil to some cotton balls and keeping it in a container and taking a sniff of it if you feel waves of nausea coming on, that can help. Adding 2 drops of the peppermint oil to a damp washcloth and putting it on your neck during periods of nausea can also help. And then as far as diarrhea goes, so it's something that some people experience. So just different bowel disturbances. Again, follow whatever the doctor's recommending in terms of medications. And then for diarrhea, we're going to want to limit that roughage like we talked about. So the seeds, the skins, we talked about taking the skin off the peaches. Bran, bran is actually the outside of the whole grain, right? So that is the part that has that insoluble fiber. Again, that's something that is going to kind of stimulate the bowels to move. So we don't want that. And then choosing the foods with soluble fiber. So that type of fiber that gels up. So things like oats, bananas, banana flakes, actually. So there's some products out there. There's one called Banatrol, and it's banana flakes. And you can mix it in with yogurt or into a drink or something like that. And that does tend to help people. Applesauce, pectin. So pectin is that soluble fiber that's found in fruits, but you can buy it more concentrated, like almost if you were going to make like a jam with it. Potatoes, rice, psyllium. So psyllium's like what's in Metamucil. And you can just get psyllium by itself, like psyllium powder. And you might try to use a little bit of that. So what that does is it just absorbs that water in the large intestine. And then again, we're going to choose less foods high in insoluble fiber. So that's like we said, the bran, the skins, beans, veggies, the skins of veggies, wheat products. We want to avoid caffeine because that can stimulate the bowels. Alcohol, spicy foods, sugar alcohols. So you might see that in certain candies or sugar-free desserts, sometimes in drinks. So anytime you see like sugar alcohol on a label, it's probably something you should limit, especially if you're dealing with diarrhea. And then for adequate hydration, we're going to want to consume 64 to 80 ounces of fluid a day. So people on the smaller side would be more towards 64, and somebody who's maybe a little bit taller and larger would be closer to 80, and then another 8 ounces per loose stool. We want to focus on foods and fluids that have electrolytes because we are losing some of that. So soups, coconut water is great. Bananas, potatoes, diluted juices. Sometimes drinking concentrated juice doesn't really work for people. It's too strong. But like a diluted juice would work. Smoothies. If you're having trouble with lactose, you might choose like a lactate as your base for that. And then using lactase enzymes if needed. So they sell those over the counter. And generally people aren't just developing lactose intolerance. It's usually something that you've probably noticed you've had in the past, but maybe is just a little bit worse, just kind of based on what's happening with your GI tract. So let's talk about changes in taste and smell. So if foods have an off taste, so there's a lot of different variations with the taste, right? So if they're off, just that like weird off taste, choosing foods with fruity or salty flavors, using marinades, adding herbs or condiments can also help. If foods have a bitter, acidic, or metallic taste, we can pair our meals with some sweet fruit. So maybe like a side of applesauce or canned peaches. Maybe drinking some sweet or sour beverages with it. So that like diluted juice. If there's something else that you like, to have as a little beverage with your meal. Using strongly flavored spices can help. Using sugar-free candies kind of in between just to kind of cleanse the palate. And using wood or plastic silverware instead of metal can help sometimes. If foods are tasting salty, we might choose naturally sweet foods using low sodium recipes. So, low sodium broths and condiments and all of that, type of thing. If foods have a sweet taste, we might want to choose bland or sour, dilute our juices, choose veggies over fruits. And then if we find that smells are a problem, so sometimes this kind of goes hand in hand with nausea, right? Sometimes those strong smells just kind of set people off. So focusing on, sometimes eating food cold or room temperature can help. So instead of like roasted chicken, we might do, you can kind of picture that has a stronger smell than say like chicken salad would. Putting drinks in a cup with a lid and a straw. So sometimes people can't get past the smell of like Ensure or Boost or something like that they might be supplementing with. But if we get rid of that, the smell by putting it in a tumbler type of a cup, that can really help us get it down without, constantly fighting with the smell that we don't like. Because the taste doesn't really taste like the smell smells, right? And then avoiding food with strong odors. So poor appetite and early satiety, something that plagues a lot of people going through cancer treatments. So obviously one or both of those side effects can lead to weight loss, muscle mass loss, and fatigue, which we know can just lead to poorer outcomes. It's like a cycle that we get into, like you're not eating, then you don't feel like eating, and then you're eating even less, and then you're tired, and then you don't want to eat. So it's like trying to break out of that cycle by focusing in on, let's focus on getting this in right now. So in that situation, people might not end up getting enough calories, protein, or fluids. Let's talk about consuming adequate calories and how we get to that point. So eating small, frequent meals and scheduling them, right? We schedule our medications. When that appetite's not there, food is our medication. It's no longer the desirable thing that it was. It just becomes a medication and we have to eat it, eat on a schedule. Sometimes it helps to use a calorie tracker, and that might be something that if you're in the same house as somebody else, they might be able to do that for you. That really just can give us a good idea of what that intake looks like. So what are our calories that we're hitting? What's the protein? And honestly, this was from another presentation I did, but my favorite tracking app is Nutrition X. It's Nutrition IX. That one is still free and it gives you all the things that you would need. MyFitnessPal you have to pay for now. And, with Nutrition X, you can scan labels still, like scan the barcodes, you can enter recipes in. So it's pretty user friendly. The other thing that can be helpful is keeping convenience foods on hand. So maybe having some snacks that you like, maybe the muffins, right? Some other things that you might, just things that are easy to grab. And then layering calories. So we could take some eggs, scramble them, and then, that's what we have, right? Just 2 eggs. But if we take those eggs and we actually into the eggs, maybe we beat in 2 teaspoons of olive oil, just kind of with our fork, just kind of beat that in. And then we might cook it in a little bit of olive oil. And then we might add a little bit of shredded cheese to the top. We've just layered the calories to boost that up a little bit. So the volume is the same, but the calories are going to be higher. So fat is actually a good way to layer calories, right? So olive oil, avocado, nut butters. So you could take your smoothie that might not have any like extra calories in it in terms of, say your smoothie has like a banana, milk, and I don't know, some oats in it. You can add 2 tablespoons of peanut butter and then you just increased it by 200 calories. If you're looking for something that's a little milder tasting, nut butter or seed butter, tahini is actually really good for that. So tahini is what they use to make hummus, like it's generally in hummus, sometimes like a sauce in Middle Eastern cuisine, but it doesn't have a lot of flavor by itself. It's ground sesame seed paste. You can kind of picture sesame seeds don't have the strongest of flavors. So that actually works really good in recipes where you don't, sometimes you don't want your shake to taste like peanut butter, right? But you need those extra calories. So tahini can be a really nice addition. And then again, with the liquid separate from meals. So we want to fit in as much of the food as we can. And if our appetite's low, that can be more challenging. So keeping it separate, just using enough to kind of moisten our mouths as needed can be, enough. If we're going to incorporate in a shake, be it one we're making ourselves or a commercial one that we're purchasing, I like for people to do it after they've eaten their meal. Because if you've ever been somebody who's had a low appetite and you've drunk, if you've had a smoothie or a shake, you're not hungry then, right? But once you've eaten, waiting like maybe an hour and then starting to sip on it, people can generally still fit it in. Just in general, like our rough estimate for calories, the amount of calories equaling a pound is about 3,500 calories equaling 1 pound. It's not perfect math, but that's kind of a rough estimate. So if people are losing a pound a week unintentionally, they're needing an extra 500 calories per day to halt that weight loss. That doesn't mean they're going to gain weight, right? That's just to stop the weight loss. And then if they want to gain weight, it has to be in addition to that. So it can be a tricky place to be, but it can be done. So this is just a little guide on a smoothie making, how you might make a smoothie. So if you want it to be creamy, you could use a milk or an unsweetened plant milk. I always point out unsweetened because if you're getting an original soy milk or almond milk, it oftentimes has sugar added to it for no apparent reason. Drives me crazy. But a cup of original soy milk has 8 grams of added sugar. So focusing on unsweetened. And then if you want it to be more of like a fruity, like clear liquid type of a smoothie, maybe the creaminess is too thick for you, it's bothering you, a coconut water base can work out really well. And then you're going to go with your fruit. So you can pick, 1 or 2 servings of fruit to put in that shake. If you want things to be a little bit thicker, frozen is going to make your shake a little bit thicker. If you need it thinned out, fresh will make it thinner. And then as far as vegetables go, you can sneak some veggies into a shake too. Oftentimes it just changes the color. I will say kale and arugula do change the taste a little bit. Spinach, I don't think does. And then you can have some avocado. That just tends to add a little bit of creaminess to it. Doesn't do much with the taste. As far as seeds go, we could do ground flax seeds. We talked about those chia seeds. You might throw in hemp seeds. We talked about tahini. And then for nuts, you could do like peanut butter, almond butter, cashew butter, whatever kind of butter you desire if you want to add that in. And then some add-ins. So we have the rolled oat flour, cocoa powder. That's one of my favorites. Cinnamon, vanilla extract, your protein powder, dry milk powder. All right, those just beeped. I'm going to grab them out of the oven. We'll take a look at them.
While she's grabbing that, I'll just remind you that your email with the Zoom link today had all the recipes as well as the presentation. So you can go back and find this page if you want to make a smoothie tonight.
Yes. I know I kind of want a smoothie after I'm spending so much time talking about it. Yeah, so my muffins are done. They smell yummy, and you can kind of see they really don't rise, but they're still really tasty. Now they do have a little bit of a higher moisture content than a lot of other muffins that you might have had. So I tend to keep mine in the fridge, just to kind of, I think with the moisture content that they have, I think they're a little more prone to growing mold. This is my favorite smoothie recipe, and you can certainly add in some protein powder to this if you need a little bit of a protein boost, but It's just my favorite. It's super yummy. Just has that nice chocolate flavor. The other thing that we can add to smoothies, if you're ever needing a little bit more sweetness to them, is dates. So dates work really well with just giving a pop of sweet to whatever you're adding it to. I will say it takes a little bit to kind of blend it all the way. And sometimes you end up with a little bit of like date chunks, which I find pleasant. But you know, if you're not one for chunkiness, you might strain it out with like a little strainer or something. These are some cookbooks that I like for, you know, people going through treatment. I really love this Rebecca Katz. She's got a couple different cookbooks and a website as well. She's got some really good things. She focuses a lot on kind of those taste alterations and recipes specific to that, which is nice because a lot of people deal with that. Some websites as well. So the recipe box is Rebecca's. That's her website. And then cancerdietitian.com, AICR, the American Cancer Society. And then I forgot to drop on here, Cancer Support Community has a lot of nice recipes on their website as well. Right, so I'm going to stop sharing my screen and then we're going to get back to this recipe. Great. So my ginger looks like it's pretty nicely infused. So we're going to just strain out our ginger. I'm gonna actually put this into a clear container because it's so pretty. So you can see the color. I think that fits in here. So see that nice dark color. Just trash. Great, and now we're going to return it to our pot and we're just going to add a little bit of honey. We're going to add 1/3 of a cup of honey. And we're going to heat it just until it's dissolved. Now this is just something that can keep in the fridge for about 2 weeks. And what you can do with it is add it to hot water for a little tea. You could add it to like a seltzer water. Lots of different things you can do with it. Great. And you can even just get like a teaspoon of it. Great. I have that dissolved. Now we're gonna have to put it in a slightly larger container. Great, and then it will thicken a little bit once it cools. You could always add a little bit more honey to it if it's not quite the thickness that you want. But great. So that wraps the recipes for today. Does anybody have some questions?
So I did. Do we just jump in with them?
Yeah.
Go right ahead.
All right, if um you have, or I, or anyone else has like hormonal differences kind of going on,
Mhm.
can you offset that unintentional weight loss with additional calories, or do you need the hormone treatment?
So you are having unintentional weight loss? I'm sorry. Or like
If you are,
if you are having unintentional weight
can
loss.
it be offset?
Yeah, I mean, I guess it depends on um obviously we want people following like, whatever medical treatment is prescribed to them. But as far as unintentional weight loss goes, yes, we can work on, offsetting it through getting enough in.
Okay.
Um, what tends to be a little trickier for people is if they're dealing with that and then also, maybe something that's affecting them from like getting enough in, like if it's something that's like with swallowing or, that's often what people, a lot of times people kind of are dealing with a couple different things that are going on. But
But
yeah,
if you're not producing enough cortisol, can that be offset with dietary, or does it need direct medication?
I'm not 100% sure about that.
Okay.
I apologize, not knowing, enough about that, but there's a lot that food can do and help to kind of offset, weight loss and things like that. And then also, people also have weight gain and, food can kind of help with that piece too, because, it all ends up being a little tricky to kind of manage, but we can, yeah, there's some.
And why did you concentrate on low sugar?
So just in general, sugar doesn't do a whole lot for us. So a lot of times people have, most people as they've aged in life tend to have a little bit of an insulin resistance problem. So
Okay.
blood sugar spikes and crashes, and we just feel more sleepy when that happens. So a lot of times people don't need to have extra, be extra tired, things like that. So yeah, just kind of focusing on the food sources of calories, like whole foods, and then just a little less of that added, more processed sugar.
Thank you.
Yeah, sure.
For your ginger
Mhm.
sauce, if ginger is not my jam, I just do not like the taste. Is there
Okay.
any substitution that you recommend? Or just make it without the ginger and just put the honey in?
Yeah, I mean, you could do like even just like sometimes lemon works well for people, like a little bit of like a lemon juice concentrated down. You could do, I mean, it kind of depends on what works for people. If you're dealing with bad nausea, what seems appealing, right? So for some people, even maybe like peppermint root with, like not peppermint root, peppermint leaves like infused down with some honey might help, might work, who knows? But yeah, it's kind of like trial and error. I mean, the ginger's been proven to kind of help with the nausea, but not everybody likes it. And if you don't like it, it might make you be making more nauseous, right?
Yeah.
Um,
Okay. Thank you so much.
Sure.
I was going to ask about your blender. What do you use?
Yes, it's the nutrition. No, it's what is it? The NutriBullet. This thing has been going strong for like 10 years. It's amazing. I just got a backup one at a yard sale for 25 cents because I was like, if this ever dies, I am gonna be sad.
And
But
you do your smoothies in there as well as the
yeah,
seeds and things you did today.
yeah, yep, I do. The only thing I had trouble with was chickpeas, like dried. I was making like chickpea flour in one of them, like with dried chickpeas. And then it was like a recipe I was making with the chickpea flour, but that really like broke the cup. Like it was too rough, but the seeds are fine. Smoothies are great. You need to have like enough liquid if it's something that you want. Like hummus doesn't work great in this. But yeah, I love it. It's perfect. It's accessible. It's not, you don't need to have like a fancy like Vitamix or anything. This works really well.
Do you know if, like, I'm not supposed to have seeds
Okay.
because of the GI issue, but when you blend them or grind them or whatever you did, does
Mhm.
that negate the negative effects?
Yeah, it really depends on like if it's more of like a diverticulitis thing or if it's like a bad like diarrhea issue. Like so if you're having a lot of loose stool, like sometimes the ground seeds will stimulate things and keep it moving more, but if people are avoiding it for like the diverticulosis pouches that they might have, blended is fine. Yeah. Well, people need more fiber when they're dealing with that to keep
Okay.
things moving regularly. Great questions. Does anybody else have anything?
All right, well, I will send out the recording from today's class, and next week, Lena, do you remember what what we're doing?
Yeah, so next week we're gonna dig a little more into like protein and like maintaining muscle mass and hydration. So kind of covering those aspects of, our needs and some fun recipes. I'm still playing around with them.
Thank you so much. It was awesome.
Thank
Thanks.
you. Have a great night.
Thanks.
All right. Good night, everybody.
Night.